Medicine is still largely focused on the male body, with sometimes devastating consequences for women.
Right now, a woman in Europe is twice as likely as a man to die from a heart attack.
While many men put off going to the doctors.
Going to the doctor, they're viewing this as a weakness.
But attitudes are changing. To save lives, medicine needs to recognize the differences between women and men. Morning rounds in the cardiology ward at Frankfurt University Hospital.
Hello, Miss Novak. We met in the ICU.
Yesterday, Sigrid Novak had a heart attack. Her husband called an ambulance. Now she's at Frankfurt University Hospital's cardiovascular center.
I was putting laundry in the washing machine, and when I stood up, everything started going black.
Was there chest pressure?
A burning feeling here and here, but mainly in my back.
That's not a typical symptom. We often think of a heart attack as chest pain that continues into the arm, but women's symptoms are often misread. When the ambulance arrived, they suspected a tear in your aorta, not a heart attack.
He ordered a CAT scan.
Then we put in a bypass and saw you had had a heart attack.
At Frankfurt University Hospital, specialists recognized Sigrid Novak's heart attack. But many women aren't so fortunate. Women often don't realize they're having a heart attack, and neither do their doctors.
We'll do an ultrasound to make sure that the heart attack didn't cause lasting damage.
Sigrid Novak is starting cardiac rehabilitation and should recover soon. She's receiving specialized care because cardiologist Lena Segers knows the different ways heart attack often present in women and men. She wants to ensure that women receive the same standard of care. That's the goal of Germany's first university-based women's heart center.
Our priority is equal care for women and men. In the ER, women should receive the same ECGs, medications, and quality of care. Unfortunately, that's still not the reality in Europe.
The United States is further ahead in this field, says Lena Segers. During her time at Harvard Medical School, she learned about what's known as the gender health gap. Now she's putting that knowledge into practice in Frankfurt. The Women's Heart Center in Frankfurt has a dedicated outpatient clinic offering care tailored to women. Alongside educating women about heart attacks and their unique risk factors, the center conducts research and offers lectures on gender medicine. Lena Segers teaches those courses herself.
Welcome to our lecture on gender medicine in cardiology.
The lectures cover gender-specific approaches to diagnosis and treatment. Lena Segers begins by challenging some long-held assumptions.
When I was a med student, the image of a heart patient was an older man with a cigarette. You carry those images with you when you're treating patients. That's why gender medicine is so important, and why we need to start learning about it as early as possible.
It's knowledge that can save lives. Take heart attacks, for example. Men typically experience these classic warning signs: chest pain, tightness, and shortness of breath. Women, by contrast, often experience chest pain as just one symptom among many. The pain often spreads into the arm, neck, back, or abdomen, making chest pain much less prominent. Women are also more likely to experience extreme fatigue, nausea, and vomiting. When they seek medical care, a lack of awareness and outdated assumptions can put their lives at risk.
We know that women are significantly less likely to receive CPR. Researchers asked, why is that? The most common answer was fear of being accused of sexual harassment. The second was the assumption the woman was faking it. And the third was a fear of injuring something in the chest, because that's where the breasts are.
The consequences can be deadly. Women have fewer heart attacks than men, but they're more than twice as likely to die from one. Gender medicine still isn't a compulsory part of medical training in Germany. Lena Segers hopes more universities will follow Frankfurt's lead. Angelina Berger may seem calm on the outside, but inside her thoughts never stop racing. She has ADHD, attention deficit hyperactivity disorder.
When I need peace and quiet, it's like there's a fairground inside my head. And when I need to concentrate, sometimes nothing works. I can't control it.
Angelina Berger lives in Cologne. Her mission is to raise awareness about how ADHD presents in women. She's convinced it would lead to fairer treatment. That's why she shares her everyday life on social media.
I thought I'd go for a walk in the park today, but it's freezing, and once again I've managed to leave my gloves somewhere.
Being so open about her struggles takes courage.
Your daughter is quiet, shy, dreamy, diligent, and well-behaved. That's normal in girls. I just had my stuff with me, and now I have no idea where it is.
She now has more than 150,000 followers.
When I started sharing my story, I thought, if this is what it was like for me, how many other people have spent their whole lives wondering what's wrong with me and are now looking for an answer?
Angelina wasn't diagnosed until she was an adult. One reason may be that ADHD is still widely seen as a condition that mainly affects boys. For decades, the typical child with ADHD had been portrayed as a restless boy who can't sit still, who's loud, impulsive, and wild. In girls, hyperactivity often looks different. They're less likely to be physically restless. Instead, they often experience inner restlessness. Some talk excessively, but because they rarely disrupt others, they're often seen simply as daydreamers or absent-minded. In Germany, boys are diagnosed with ADHD almost 3 times as often as girls. Angelina doesn't believe that's a coincidence.
To me, it's connected to misogyny in medicine. And not just in the last 5 or 10 years, but for centuries. Women haven't been taken seriously. When it comes to ADHD, we're still seeing it through a very male lens.
Angelina's goal is to bring ADHD in women out of the shadows. Her family doctor, Yvonne Knabe, agrees.
How are you?
Pretty well, actually.
Women learn to hide their symptoms, and when they finally seek a diagnosis, they're often met with disbelief.
People say, but you finished university. You're raising 2 children. You have a happy marriage. Why are you here looking for a diagnosis? It's so hard to let that mask drop. You need people who can peel back all those layers and see what's underneath.
Yvonne Knabe is now helping other women like Angelina get the support they need.
I was the one who suggested she get assessed. At the time, I wasn't diagnosing ADHD myself. But more and more people were saying, I'd like an appointment. I think I might have ADHD. Eventually, I thought I should get some additional training on the subject. My goal is to help every patient find the approach that works best for them.
Yvonne Knabe can now diagnose ADHD herself. But there still aren't enough qualified doctors to do that in Germany.
That's really good. 115/80.
For Angelina Berger, finally receiving an ADHD diagnosis came as an enormous relief.
I wanted to hug the whole world and shout it from the rooftops. I finally understood what's going on with me. I want to help and get that message out into the world.
He's too eager. He's going to jump into that water.
Here, Freddy.
When Barbara Panev takes her dachshund Friedrich for a walk, she likes to have her husband with her. For the past 2 years, she's been suffering sudden attacks of chest pain, shortness of breath, nausea, and a racing heart.
It feels like I'm breathing differently, that my heart is beating differently. It completely takes over my body and leaves me with this overwhelming, crushing feeling. It's terrifying.
When Barbara went to the hospital, her symptoms suggested a heart attack, even though she was only 34. But the tests showed no blocked arteries. Barbara was discharged without any explanation for what was causing her symptoms. Even so, she was prescribed 3 powerful heart medications, which she still takes today. For the young mother, it felt like her life had changed forever.
As a woman, you're often not taken all that seriously. You get the feeling that people assume it's all in your head, instead of considering that there might actually be a serious physical cause.
Barbara learned about the Women's Heart Center online. By looking for heart conditions that are more common in women, cardiologist Lena Zegers hopes to solve the mystery.
Hello, good morning. Come in.
To learn more about Barbara's heart, Lena Zegers recommended a cardiac catheterization. Women are still far less likely than men to undergo this procedure.
Unfortunately, this specific test isn't done very often. We've only just begun to understand its usefulness in recent years. That's a major problem, and why I believe Germany needs dedicated women's heart centers.
The goal is for women to be offered these examinations just as routinely as men. But Barbara Panev is nervous.
Are there risks involved?
The procedure can sometimes trigger an irregular heartbeat, but you'll be monitored the entire time, so there's no need to worry.
During the procedure, doctors will deliberately trigger a spasm in Barbara's heart, just like the ones she sometimes experiences.
I'm afraid of the spasm because it was such an awful experience. But I'm going to think carefully about the catheter procedure. I want some time to think it over.
Barbara Panev is torn between wanting answers and fearing the test that could provide them. Meanwhile, in Mainz, ADHD advocate Angelina Berger is on tour. Her husband and tour manager Jonas travels with her. The show doesn't start for another 5 hours. It's raining outside. Because there's so little to do, Angelina's thoughts begin to race.
If I had a screwdriver right now, I'd adjust these doors so they're level. It drives me crazy. Just like the cameraman's socks, the bright color keeps drawing my attention.
In just a few minutes, she'll be on stage. Her live show is helping audiences across Germany better understand ADHD. But at the very last minute, things get hectic. She realizes that something went wrong at her last performance.
Yesterday, I suddenly realized that 2 of my slides were missing. I had to improvise. I must have deleted them by accident. One of the core symptoms of ADHD is impulsivity, which is usually viewed as a negative thing. But for me, it's also a source of strength and creativity, and my ability to adapt.
And tonight, she'll put it on display once again.
Welcome, everyone. Every time I have to stop and think, what city am I in again?
Angelina uses humor to raise awareness. But there's a serious message. No one with ADHD should feel weird or wrong, regardless of their gender.
This is something we need to change. It affects us. And if we don't fix it, who will?
Her mostly female audience embraces this new perspective. For many, it's the first time they've truly felt seen.
Maybe we are a little weird, but there are an awful lot of us. And it's about time the world got used to us. Thank you.
Some people in Germany dismiss the increase in diagnoses among women as a trend. Angelina believes that ADHD in women has always existed and is now finally being recognized. And it's not only women who face gender-related health issues. Men have their own health-related blind spots as well. Enda Georgen sees this every day in rural Ireland. He looks after the health and well-being of farmers.
They won't ask for help because they think that it may be a sign of weakness. So they're very proud people, farmers, especially male farmers.
In the sparsely populated northwest, the agricultural advisor spends his days travelling from farm to farm. Irish studies show that many farmers keep health problems to themselves. They often don't see a doctor until it's too late. Advisors like Enda are trying to change that.
How are you doing, Tommy? How's things with you? Fair play to you for doing this.
Today he's visiting sheep and cattle farmer Thomas Flynn.
Did you find cattle here, haven't you?
I'm going to feed some of them here now. Come and have a look at them.
Right.
Irish farmers have a reputation for putting work and the welfare of their animals before their own health. Advisors like Enda Georgen are among the few people outside the family they see regularly. Years of trust have helped him spot warning signs before they become emergencies. But first, they talk cattle.
Yeah.
If you're using nuts, the crows.
They're content.
Content, yeah. So they're around 750 kilos now at this stage.
Yeah, yeah.
So they should be well fit and they're well finished.
Enda listens carefully for what's left unsaid. When necessary, he encourages farmers to see a doctor.
When you have them there, talk to them about the issues, talk to them about maybe what is affecting him, maybe about what's going on in his life, and get him to open up to you over maybe a cup of tea.
Courses like these are part of Ireland's National Men's Health Action Plan. Rather than creating entirely new services, the programme adapts existing healthcare to better reach men. It focuses on risk factors such as smoking, alcohol use and obesity, often targeting specific professions or groups. Public awareness campaigns and school initiatives are also part of the strategy. The approach appears to be paying off. Life expectancy among Irish men is well above the EU average. Enda works with nearly 300 farmers, like Vincent Igu. And as always, he starts with the same simple question.
How are things with you, Vinny? Everything all right? Everything going well for you?
Going good, yeah.
That's good.
Good to be out and about and talking to people and, yeah.
But Enda doesn't just leave it at that.
Is it a lonely place to be by times?
It can be. It gets easier this time of year when cattle get out and during the winter it can be long.
Yeah.
At 35, Vincent is determined to do things differently from his father's generation.
Great.
Yeah, with food I need a triple.
Too many of those men put their own health last.
Yeah, I've seen a few cases, of farmers dying with cancer actually and wouldn't have gone and with symptoms that other people that have gone straight away with and left it there lingering thinking it would go away. Yeah.
What happened to them?
Buried, dead, yeah.
Yeah.
Health advisors like Enda Georgen are working to prevent tragedies like these. They're not doctors, but they are trained to recognise warning signs and persuade farmers to seek medical help before it's too late. Last year, for example, Enda convinced a farmer to finally have his blood pressure checked.
I was sort of joking, half encouraging him, but I was serious going and get it done. And when he went to the doctor, within 2 days, he had a stent in place where he had a 90% blockage in one of his arteries.
That may well have saved his life. But many men here are still taught that strength means staying silent, even when they're struggling. Construction sites are still seen as places for real men. But beneath that tough exterior, nearly 1 in 8 male construction workers in Ireland suffers from depression.
A lot of my friends, they've gone through it and they're maybe still going through it.
It was a friend of mine, yeah.
I had a cousin that committed suicide.
No one could pick up those signs.
At just 24, Ben Hennessy has most of his working life ahead of him. But he's already had enough of the macho culture on construction sites.
I feel under immense pressure, I feel under stress, and sometimes I go home after a long day's work and all I can do is go into bed, and sometimes I wonder, I have to get up in the morning, I don't really feel like I want to.
Many construction workers here feel the same way. That's why Ireland's National Centre for Men's Health and Jack Sweeney have developed a mental health programme for the industry. Its goal is to help prevent depression and suicide. The programme encourages construction workers to rethink what strength and masculinity really mean.
So we tried to do is flip the script on, it's actually more manly, if you want to put it, or tougher to open up about these things and be vulnerable than it is to just close down and hide away from addressing issues.
Today's session is led by Finian Murray, one of Ireland's leading experts on men's health. He's showing the construction workers how to talk more openly about their worries and struggles. Ben Hennessy is also here. Some stark facts help drive the message home.
It's 6 times more likely to die by suicide than in a workplace accident.
Construction workers aren't the only ones at risk. Across Ireland, men are almost 4 times more likely than women to die by suicide. In Germany, the rate is about 3 times higher for men than women. The workshop teaches participants how to recognize the early warning signs of suicidal thoughts and depression. In men, those signs often look different from what most people expect. People usually associate depression with sadness, exhaustion, and withdrawal. But in men, especially in the early stages, it can look very different. Some throw themselves into work. Others become obsessive about exercise. Many become irritable or aggressive. Some turn to alcohol or drugs. Learning to recognize those signs and having the courage to act when it matters most is one of the program's key messages. It's still a pilot project, but Jack Sweeney hopes mental health programs will soon become a part of everyday life on construction sites.
I want to roll it out as wide as possible for the construction workers, because they're at the most risk in Ireland at the moment, and then adapt it and implement it to other male-dominated industries, and hopefully that framework will do wonders on Ireland.
Ireland is showing how men can build a healthier relationship with themselves so they can lead healthier and better lives, both physically and mentally. It wasn't easy, but Barbara Panev has come to Frankfurt for the cardiac catheter procedure. She finally wants to know what's causing her symptoms.
I'm incredibly nervous and really scared.
Perhaps that's because Barbara is a nurse herself and knows just how much can go wrong. But she no longer wants to keep taking medication without a clear diagnosis.
Okay, see you later.
See you later.
Lena Segers wants to give her some answers.
Doctors often try different medications and think, well, hopefully something will work, without getting to the bottom of the problem. That places a burden on patients and our healthcare system. And it's not how we should be practicing medicine today.
Lena Segers suspects Barbara may have coronary microvascular dysfunction. In this condition, the tiny blood vessels supplying the heart don't function properly. It's a disorder that affects women far more often than men. Together with her colleague, she's about to find out whether that's the cause.
Right, 5001. Let's move the wire forward.
A fine wire is threaded into Barbara's blood vessels. Is blood flowing normally through the tiny vessels near her heart?
Very delicate blood vessels. Everything looks completely normal.
So far, so good. Barbara is under a local anesthetic and is awake throughout the procedure. Now she's given a drug designed to provoke a coronary spasm. The first dose.
So you don't feel anything in your chest? That's a very good sign. No reaction. Let's move on to the next dose.
2 more doses follow. Still nothing. It's a huge relief. Barbara's heart responds completely normally and appears healthy.
Okay, we're done.
Barbara's chest pain isn't coming from her heart. Additional tests could reveal another cause, but the most important news is good.
Your test results were completely normal. That's wonderful news. Based on what we found today, we wouldn't recommend continuing the medications. These drugs can have side effects, and they were prescribed a couple of years ago without a proper diagnosis.
For 2 years, Barbara took 3 powerful heart medications every day. She's relieved that chapter is finally over.
I'm really happy about it. I was taking more heart medication than my own grandparents. I'm so grateful I can stop.
In Frankfurt, Barbara Panev's heart has finally been properly examined. She's now a step closer to finding the cause of her symptoms. Her story shows why medicine must account for differences between women and men and treat every patient on an individual basis.